that section of the agenda.
Okay.
Well, then let's call the meeting to order. Meeting of the July 13th Human Services Commission. Roll call.
Chair Bottenberg,
Present.
Commissioner Nishioka,
Present.
Commissioner Mir,
Present.
Commissioner Banak,
Present.
Commissioner Gunno,
Present.
Commissioner Heilman, and Commissioner Varnes.
Present.
Thank you.
Okay. Commissioner Harmon, would you be good to lead the Pledge of Allegiance?
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Do we have a motion to approve the agenda?
Making a motion to approve the agenda.
Do we have a second?
I'll second.
There's been a motion and a second. Is there any discussion? There being no discussion, call for the vote. All those in favor of the agenda as presented?
Aye. Aye.
Any opposed? Okay, the motion passes. Approval of the minutes of the June 29th regular meeting. Do we have a motion to approve?
I'll make a motion.
Is there a second? It's been a motion and a second. Is there any discussion? There being no discussion, the motion to approve the minutes of the June 29th meeting. All those in favor say aye.
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 Any opposed? Motion carries. Do we have public comment?
Commissioner Bottenberg, we do not have anyone in the chambers for comment, but I do see somebody online. Mr. Sewell, if you would like to provide comment, please hit the raise hand button and I will unmute you. The raise hand button is at the bottom of the Zoom toolbar. We'll just give this individual a moment to see if you would like to provide comment. Okay. We'll actually unmute him and just ask him directly if you'd like to provide comment. Hi, Bert, can you hear us? Bert, can you hear us? It looks like you're muted. Okay, I'm going to ask him to unmute. Okay, it doesn't look like Mr. Sewell is looking to speak tonight for public comment, so I will remute him, and that is all for public comment.
Thank you. We will move to new business and my esteemed commissioners to my left. Would you proceed? Commissioner Gunno, do you want to start?
I didn't have an opportunity to participate in reviewing.
Okay, so that we have a lot to get through tonight.
You want to carry it?
Yeah, sure. So Mark and I reviewed all of the applications. We met with Rita last week to go over them. Thank you, Rita, for providing a lot of context as to like previous years, and then as well as the relationships that the nonprofits had formed that Mark and I didn't have since we're new to this. So we have 33 to look at. We're going in order of the grant request dollar amount on down. So Mark, do you want to start since you took the Friends of Youth the Landing?
appreciate any questions along the way or re-guidance for us. Greatly appreciate historical knowledge.
Do you want to hit your microphone?
Oh, thank you so much. Yes, there we go. Thank you. So yes, appreciate the insight from staff last week and then other commissioners' assistance along the way as Julie and I walk through. So the first program that we have requested application is Friends of Youth, and this is the Landing Shelter and Resource Center. This is the only emergency and enhanced shelter for youth and young adults experiencing homelessness on the east side of the region. They provide wraparound services that connect clients to case management, mental health, and employment support. Their projection is, their anticipation is that in the next year, they will double the number of youth that are served and will have a new location in Kirkland. So in 2021 biennium, the city granted $14,750. The request for this biennium, 2023, is $40,000. And as we walk through the need and their descriptions of their understanding of services and needs, that our judgment was that we would like to recommend $30,000 to Friends of Youth, the landing shelter. Request is $40,000. We recommended $30,000.
And then just to add a little bit of more context to what we noticed in a lot of our applications, and I think the rest of you did as well, a lot of requests for increase over previous year due to cost of service delivery, right? Paying staff living wages, just cost of delivering services. And another piece that Rita filled us in on is that with the agencies that help homelessness, we typically don't look at number of residents served. We look at it more in the context of being a regional partner to the east side, all of the east side cities. So I think this one falls in that.
Yes, absolutely. As a regional service. And we had a few of those, some of them that we looked on favorably and some that we were not seeing as quite as beneficial to the region and to Sammamish residents.
Could we have you speak louder?
Yep.
Both of you. Thank you.
Good deal. So any discussion further from there on Friends of Youth, the Landing Shelter and Resource Center? And our recommendation is $30,000.
What intrigues me is that's for ages 16 to 24.
Yes, the upper end there is what you're pointing out, Joyce, of 24. And much along lines of transitional and
Yes.
kids that are aging out of service is my anticipation we have there.
Okay. The next one we had was Imagine Housing. In the 2021 cycle, we granted them $16,350. They requested $40,000 this time. They are 15 affordable housing communities across the east side, including one in Klahani. They provide low-income housing support, again, increasing need and more staff and more staff for retention was one of their needs. They state that nearly a third of their residents are low-income, restricted income seniors, and their goal is stable housing and thriving residents. So we recommended in this case, they requested 40 and we're recommending 25. And the reason for that was Rita had some feedback, and I believe, Mark, you possibly have heard it as well, about their perhaps the running of the units. There were some issues there.
Yes, correct. Not sure I have much more to add beyond that, but yes.
Oops, sorry, that's loud. When you mentioned that they had issues around running, did they have a hard time meeting their service units or anything last time?
So I know that the actual organization had a tremendous amount of like the whole board resigned en masse.
Geez.
Which, and then they also had problems. So we fund them, but they also in turn work with a property management company. And so so it was really trying to make sure that like the residents were getting to know about the services that they offered, and it very much was dependent on the property management company. So
They don't have case manager?
so it's like a residential manager, so
Okay.
it's almost
Yeah.
like a case manager. So I know that that's like, you know, last go round we gave them a lot less. It's like almost triple the request. They put it also down to staffing, as Commissioner Varnes talked to, but they also have 54 units in Klahani area for low income housing. Yeah.
Have they, do they have a board now?
Yes.
Okay.
Yes. It's evolving.
Okay.
Yeah. Yeah.
Cool.
Yeah.
All right.
And I will go back to what Julie mentioned. I'm sorry, I was reading and I wasn't listening as well as I should have. As far as some of the challenges, there were significant issues that were brought by residents to at least a few city councils and other folks that are funders of maintenance issues, as Rita mentioned. But so there is quite a bit of awareness of their services and need for some of those facility upgrades and maintenance stuff.
Confident are we that they have resolved these problems or that they're on a clear path to getting them fixed?
Can I also just add very quickly? So we also, as they had also approached council for a one-time allocation of funding. So they wanted to bring all their residents up to speed on rental assistance up until, I believe, April. So we gave a one-time allocation of funding, I think of they used $35,000 to bring everyone up to speed. Because the PrAP program at King County had closed. And so, you know, we had brought everyone up to speed there. As far as Commissioner Banak, as far as their service units go, they've always been able to maintain their service units. Some quarters they don't achieve them, and that really is dependent on the property management. And so when they're not able to achieve their service units, we don't give them the funding until they've actually achieved their service units.
So yeah, we decided not to recommend their full request of 40,000, but we thought 25 was fair. It's an increase over the previous year. And then knowing that they have to perform their service units in order to get their funding, that gave us comfort that, you know, they would have to achieve that in order to get the funding. Any questions on that one? The third one was St. Vincent de Paul of Seattle out of the Mary Queen of Peace location. In 2021, we granted them 20,000 and they requested 40,000 in this cycle. We had a discussion about this one. This is all volunteer run, and basically every dollar that goes in is sent out for emergency funding for short-term rental assistance, utility assistance. They said their increase allows for inflationary increases. We are recommending 30,000, so not the total that they requested. So it's 10,000 more than the previous year in order to meet the need of you know, higher rents and utility bills, but not fully up to their full request. Mark, did you have anything else to add?
I don't think so. I think we did discuss with staff just the credibility that there is awareness of how they distribute funds in a non-sectarian way and are receptive to all that come. So.
Any discussion on that one? Okay, the next one on our list was the Eastside Legal Assistance Program, Stable Housing. They did not receive a grant in 2021. They're requesting 25,000. Let's hold on, let me pull up my sheet here. Sorry. This is a first-time request, and they cited increasing need, expanding programs, especially with the eviction moratoriums that are expiring. they are making this request in order to expand their program and add additional staff. So they're requesting 25,000 across multiple cities. And Sammamish actually did have a good number of residents who were served by the sorry, they have a projection. I'm sorry. It's a projection of 37 Sammamish residents that will be helped. So we thought that we should fund it. We recommended 10,000 in this case, just because it's a sort of a seed program to provide additional staff into these different cities, and they've requested the 25,000 across multiple cities. So we decided, based on the number of residents, that we thought 10,000 would be a good amount for us to start with, and that, but if we had additional funds, that we would say 5,000 could go to them.
Did they not appeal to other cities in the past?
They have, but this is the first time they're expanding it.
Okay, because I don't see anything from other cities here. Well, they got Bellevue and Kirkland.
Yeah, but if you look at their current year request, I think they're requesting 25,000 across multiple cities, including Sammamish.
Including the projected number of residents in the
Correct.
same thing.
Yeah.
Commissioner Bottenberg, can I also just add that like Kirkland and Bellevue actually have allocated funding for a full-time attorney to look after residents in both those municipalities. And as Commissioner Varnes was saying, this would be a joint kind of funding allocation amongst many cities.
Do you know if they also use pro bono legal help as well as paid attorney?
Yeah, they do pro bono and low bono. So yeah.
Just to clarify, all of their services are free. And they, Commissioner Rich, all their services are free. So they're all pro bono, but they use pro bono attorney, volunteer attorneys. Yes, they do.
It sounds like they use a combination of pro bono
And paid staff.
Eh,
Yes, correct.
Yeah, so this funding would go towards a staff attorney. Any questions? Okay. The next one was Essentials First, their community kits. This program provides personal hygiene kits like shampoo, detergent, razors, and clean items for low-income families and refugees and people experiencing homelessness. There's no specific programs in their request. They state no specific programs address this need, and food banks typically don't distribute this type of item. Their goal is to pack 300 of these kits a month, and they distribute them through the Bellevue and Lake Washington school districts and other programs like MAPS and refugee resettlement programs. Mostly volunteer, and they're looking to add paid staff in for this request. So from us this year, they requested 25,000. They did not request a grant or receive a grant in the previous cycle, so they requested 25,000. Mark and I thought it's a good program, and they're helping a wide spectrum of families in homelessness, refugees, people in need. They're trying to add paid staff. So we recommended 10,000 against their request of 25, and then additional, whoops, sorry, nope.
Yeah,
We
I think
recommended
we're-
5,
yeah,
sorry,
5.
wrong line. We recommended 5 because it is a new program getting off the ground. We'd like to see their service to the city of Sammamish residents.
We did see credibility in the efficiency of the program, and then working with and collaboration with other service providers around the region. So not trying to do something on their own, but providing a service that's not part of food banks, et cetera.
Are they a new organization too, or just a new program?
I don't believe they're a new organization. Go ahead, Rita.
So Commissioner Nishioka, they were called another, and the name, they have a rebranding. They were called, I believe, Kits for Peace, I believe, and now they've rebranded to Essentials First.
Okay.
So yes, so they had in the prior funding round had asked for funding for different programs. Yeah.
Okay. Thank you.
Okay, any questions on that one? All right, the next one is Essence Health and Research Foundation for their Project Thrive. This is a new program offering clinical nutrition yoga and emergency kits for residents that are in need. The services are mostly delivered in person, the kits. The issue we had with this one, their request was 20,000. I had not received a grant in the previous cycle. We had questions within the application. It seems associated with the for-profit Health and Research LLC, and it wasn't clear exactly how the two were separated. And then just the sheer number of assistance they provided was 11 kits delivered to residents. And so we just felt like it was not really within the essentials needs. It was unclear how the two were separated and their service delivery was low. So we actually recommended, they requested 20 and we recommended 0.
We also had concerns as well, just that the spectrum of services, we had a little bit of difficulty seeing that there was focus. And so seeing that each of these services, very appropriate, very needed, but it did seem like there was kind of too wide of a range kind of for what we have seen, and just a different focus than some of the other essential services, that basic services that seemed appropriate.
And I would agree too, because they don't even have any, there's no projected service units. There's no projected residents served. So,
Yes, we requested that information and Rita did follow up, but the actual service units were low.
So if you recall, there were 11 residents served. I think 2 of those were from Sammamish and the others were from other jurisdictions.
And again, with that low number, we were not also seeing a regional need as well that would override that.
Any further discussion? No. Okay, the next one is Issaquah Community Services for their emergency financial assistance program. This is to residents who live in the Issaquah School District, and it goes towards helping pay rent, utilities, other emergency needs. Their request was 20,000. They received 17,400 in the previous cycle. They had an increase in their request. They lost some one-time donations from the Seattle Foundation and Seattle Puget Sound Energy Foundations and a specific individual who had done a large donation. They provide assistance every 6 months and try to get the money out within 5 days of a request. They partner with agencies like HopeLink and Issaquah Food and Clothing Bank. Their goal is to avoid eviction, but they do not help if eviction is inevitable. They won't, Sammamish residents, they helped 207 in the previous cycle, 2021 cycle, and they estimated 225 in the upcoming cycle. So again, they requested 20,000 and we recommend 20,000. Slight increase, but also due to increasing costs.
And they're all volunteer. They've been around since 1973.
Yeah. Any other comments, Mark?
No, I think you covered well. Next one is Issaquah Food and Clothing Bank, and very comparable actually here, that this organization with high credibility, efficiently used funds, what we understand, and low barrier access to food and clothing for residents that live in Issaquah School District. And so as we looked at their needs for a full-time case manager, their request in the 2021 biennium was for 20,000, which is what the city had granted. And for this biennium, the request again was for 20,000, and that is what we are recommending as well, as 20,000 for 2023. Any questions? I believe our next then is Essentials First, and just Essentials. And this is a program that is new, and their intention is to provide local food banks access to essential hygiene items to distribute to clients, and they plan to procure and distribute household and personal hygiene items quarterly to families. The request was for $19,125. And again, as with a couple of other new programs, we decided to recommend some beginning funds and at the level of $5,000.
What's the difference between the kits and this one?
Yeah,
That's a good,
that sounds,
This is food
Oh, this is
related.
food.
Yeah.
Yep. Oh, wait.
it
No,
says
I-
it's
Sorry, I'm
access
sorry.
to-
This is non-food
it's
related.
essentially like access to hygiene items in both the programs. So I was wondering why they have two different programs.
Yeah, I didn't know that
It's-
either.
it's-
Actually, now that I think about it, I think that was our confusion too.
Yes.
It wasn't
Yeah.
quite
and I
clear.
remember we
Yes.
discussed it, but I don't
Yeah.
remember what our conclusion was. So
Yeah.
I think this program, Commissioner Mir, is the Just Essentials program is with food banks.
Yes.
And then the other one is with like members of the public, kids in schools, immigrants, refugees. So I think in particular, having culturally appropriate food for food banks is my recollection.
No, this one is
No, this is
essentials.
hygiene.
Oh,
Yeah,
I'm
this is
so sorry. You're
essentials.
right. It's actually
Yes.
household
Yes.
and personal hygiene items. Yes.
that
Sorry,
they
I
will
beg your
distribute-
pardon.
Use the
Yes.
food banks to distribute versus the other
Yes.
program that they will distribute through school
Directly.
districts
Mm.
and other. So this would be supplying the food banks with those essential items to distribute.
Okay.
And again, it's a new program. We'd like to see some performance before we give them a larger grant. So we recommended 5,000.
correct.
So did they list, I need to go through it. Did they list which food banks they're going through?
Hope Link here.
Hope Link, Issaquah Food and Clothing Bank, all the regional partners. They said they've piloted it with 5 and they're now ready to scale.
Cedro Woolley, Port Angeles, Kent.
I mean, it's essentially the same program. It's just the distribution channels are different. I wonder whether they have these two programs because they think that the funding for the two programs will come from different sources. That could be the rationale, but essentially these are just different distribution channels, but
Mhm.
it's the same program essentially.
Yep, we could ask them, I suppose, why they just decided to break them into the 2 different programs.
Yeah, I mean, I just wonder why they haven't consolidated the two, right? Because the basic program is not different. It's just that they're using different distribution channels. Yeah, exactly.
Mhm.
Exactly. Exactly. It doesn't seem efficient to me. Exactly. Yeah.
Could read it, staff, could we get additional clarification maybe on
Yeah.
that?
Absolutely. Yeah.
So our next then, am I correct, is Hope Link Adult Education. And this is classes to help students earn their GED, high school diploma, English for work classes to help immigrants and refugees improve their English and prepare for employment. And then students guidance on career goals and practical job search support. So we kind of, as we looked at a number of these, we were also kind of seeing spectrum of care and some of the things that would help on basic needs, and also so that folks could provide for their own basic needs in years to come. And so the request was for $19,125, And I'm sorry. Yes, and our recommendation was 5,000. Again, is encouraged. I'm sorry.
No,
I didn't flip pages. I apologize. So the request was 19,000 and we recommended 8,000.
Are there other resources to help people with get their GED? I don't know whether these school districts, do they also provide similar services with helping adults get the GED, or are there other organizations that do similar work?
Lake Washington Institute of Technology does GD.
Yeah, Bellevue Community, Bellevue College. That's the things that come up my, yeah.
Did their proposal, since they're working with refugee immigrant, I didn't read the proposal, so did they, is it clear that they had staff that were from the immigrant refugee community?
Sorry.
26 to 50% BIPOC.
They have translated materials program and agency staff that speak languages. They didn't say specifically.
Okay. Just
And then-
curious.
Yeah, and they have interpretation on demand.
Yeah.
But they didn't say specifically, but the target, they do target specifically for the English for work as refugees, people seeking asylum, and immigrants ages 18 who want to improve their English skills for employment or enrollment in college.
Mhm. I mean, I think HopeLink is an established organization, and they probably is not a new program. They've probably been doing this for a while. So I think 8,000 is a fine recommendation. I was just
Yeah.
curious.
Going on then. So our next one is Friends of Youth, Youth Employment. So this is a new program. So there were not funds in 2021, but it's a new program working with young people experiencing homelessness to develop skills and resources that promote financial independence and individualized support from case managers, and then employment opportunities through agency subsidized paid internships. The request was for 15,000 and we recommended 7,500.
And it's the same age as 16 to 24 is the
Still
limit.
the 16 to 24, yes.
Is there a large problem with youth unemployment? I mean, I go out to QFC and they're offering like $21 an hour, or pet markets, and for people. How much of a problem is there?
I noticed that they project one Sammamish resident
Yep.
for this grant.
So this program is more to help them become employable and coach them, how and engage in employment seeking. It's to try to help them transition and develop employment skills.
And probably raise for lack of a better term, raise the ceiling on what they can do as far as beyond some of those beginning positions, but also to have financial independence beyond what maybe, starting wage positions may offer.
Well, and
I like the term wraparound services.
well, having worked with the homeless community in the past, I know that WorkSource also provides this service to people in need. So I'm not sure.
Do they focus on youth though?
Yeah, this one focuses specifically on youth.
This focuses on the whole person, doesn't matter on age. If you're old enough to be able to work, you can go to WorkSource, get counseling, get help with resumes, improve your skills. So,
That's a state agency.
yeah.
Are they in Sammamish? Do they do work in
They're in
their
Redmond.
state, their?
I think they're located in Seattle now.
Work sources in Redmond.
Redmond.
Yeah.
Is there one still
Yeah.
in
Yes,
Redmond?
right.
Yeah,
Okay.
and then Commissioner Heilman and Commissioner Varnes, I do know that the recommendation of 7,500, I've noted that you also said that that would be one of the ones that you would cut if needed.
Right.
So just reminding you.
Yeah, yeah, that was one of the ones that we did not rank
Right,
highest.
we're not right, yeah. Okay, so the next one is Sophia Way for Helen's Place. And so this one, they were requesting 15,000, which was up from 10,000 in the previous cycle. We did recommend funding the 15,000. Again, they cited cost of delivering services, primarily in wages to employees. This is shelter services and counseling for women experiencing homelessness. They particularly talked about older women who are, and disproportionately women of color who seek services. They assist approximately 40 women a day. They have a low barrier to access and most nights at capacity. And I believe, Mark, you've had experience with them.
Quite a bit with Sophia Way, yes, yes. Just high credibility, very open, transparent, very easy relatively easy access for women, yes.
Projecting 53 bed nights and 1 hour of case management. I'm looking at Sammamish across.
Yeah, so we felt good about our recommendation
Mhm.
for this agency.
This is a regional good one for sure.
Mhm.
Yes.
And it's for women and children as compared to so many men ones coming up here.
I know.
Yeah.
So nice.
Mm,
Yeah, and that was actually one thing we discussed at the very start, was making sure we were equitable
mhm.
with shelters that addressed men and women. And so these next two, this associated with the Sophia Way, I think we funded them at the full amounts at their request.
Yes.
Okay, so the next one is Sophia's Place. This one is a 24/7 extended stay shelter for women over the age of 21. They provide case management, mental health and substance abuse support, and employment training and placement services. Again, Mark has had experience with them. In the previous cycle, we granted them 10,000. The request this time was 15. Increased cost to deliver services. The average age, interestingly, is 48, and 30% are over the age of 55.
I would say as well, they have done a good job as far as education and seeing some of the coming needs as well. So not just serving who they currently have, but looking down the road and seeing increased need for senior women.
Any discussion on this one? Okay, the next one is Catholic Community Services, their new Bethlehem programs. This one provides 24/7 full year shelter for 18 families experiencing homelessness. They provide showers, laundry, meals, internet. They provide case management and on-site behavioral health and substance abuse counseling. Their request was flat year over year. So 10,000 in the last cycle, which was granted 10,000 again in this current cycle. We did recommend 10,000. They also cited cost of delivering services, increase in wages, increase in hotel rates, and increased demand for services. But interestingly enough, they did not request an increase from the city of Sammamish. And
Do
go ahead.
they largely focus on the Catholic community, or?
I think they provide services regardless of denomination. They're just affiliated with
Okay.
Catholic community
And I
services.
would say that was a question on each of these, including MAPS and St. Vincent de Paul and Catholic Community Services, I may be missing somebody, that Congregations for the Homeless. We did ask that question and looked into that with each of these services. So
I've,
Typically, Catholic Community Services are there. It's open to anyone, and they
we're
don't,
open to all.
you know.
I've worked with them before.
My guess is that they didn't, maybe they were flat because they didn't maybe have served that many. They project serving more this year, but they actually they didn't serve that many. But again, it's kind of a regional kind of program that all the cities
Yeah.
need to pitch in. So
They did. They requested large increases from other neighboring communities, so they probably did not project any more additional Sammamish
mhm.
residents, even though it's hard to tell where a resident might come from. Okay.
our next two, I believe, are for Health Point. So kind of looking at these, we discussed the agency together and credibility that we saw in their application and as staff explained to us. But the first one is for dental care, an explanation of some of the gaps for folks in need that do not have dental care. And again, looking at something that is a basic need of health and nutrition and being able to care for oneself well. So the grant in 2021 biennium was $4,000. The request in 2023 is for $10,000, and we recommended the $10,000 level.
And the same individual account of 213.
Do they work with specific dentists, or are these their own dentists that they use?
I checked them out online. They actually have a list of probably 15 to 20 dentists throughout the area, not just Redmond, but all the way down into Renton and Kent, Tukwila. And so the service area is very wide. And they will accept insurance, but also they have financial assistance if people need it. So yeah, I checked them out because I got to find a new dentist. So I said, well, maybe I'll look at them.
I see online, there's a lot of people asking, hey, I'm low income, but I have some dental problems for me or my family, and I don't know what to do. So
Yeah.
So this is free care though, right? This proposal is to provide free
Yeah.
dental services though, right? Even
Correct.
if they charge other,
But they
And take
do
insurance.
have the opportunity or
They have
the
healthcare.
option of providing dental care for charge.
right? Did they,
They do accept Medicaid, and most patients, they say, are covered.
okay.
Yeah.
Did they have mentioned how they determine like which clients would patients would qualify for these services in particular? Are they like, do they have an income level? Did they mention that? How do they if they take other patients as well that can pay? I'm just curious how they determine which patients are going to get benefit from
Yeah.
Well, I
free
think
services funded by City of
wasn't-
Sammamish.
a lot of the patients were at income that they've served were at income level of $15,000 or less or something like that. I can read it again.
Yeah,
if you
they
want.
said in 2021, of over 81,000 patients we served, 88% had incomes at or below 200% of the federal poverty
Mm.
level. 31% were children.
Mm, cool. Mm.
So that number of patients and the income.
That's a large
level is
number.
what-
Yeah.
80% of the city residents served by the dental care program are funded with human services funding. They're low income. So 80% of
Got
the,
it.
yeah.
Thank you.
Further discussion?
Oh, and they have a clinic in Redmond, right?
Yes,
And-
that's correct.
We're at the Together Center. Are they going to be there again?
I believe so, yeah.
When they open.
It's getting close.
Okay, our next request is also with Health Point, and this is medical program. We had some questions about service and so the funding level in 2021 was there was not funding, and this year the request is for 10,000. Again, this is comprehensive primary medical services rather than dental, and serving low-income residents who face cost and insurance barriers. And again, at the clinic in Redmond. Maybe Julie, you can remind, we recommended at the $5,000 level, not the $10,000 request, but with the option of adding the additional 5.
Exactly. I think because we hadn't funded them in the past, we decided to go with half of their request, but if we do have additional funds, we would fund additional 5, because they did actually serve 97 residents
Correct.
of Sammamish in the last cycle, and they are projecting the same.
Do you have a good feel of who their demographics are? The young families, older people?
Rich, I think you're off mic.
Did you ask
sorry,
about
there
their
you
demographics? Is that what you said?
Yes, basically it's young families, children, older adults.
Looks like it's the same numbers as the other one.
The
Yeah.
same income level.
They cited the same, 81% or 81,000 patients served, 88% were low income, low to moderate income, 31% were children, 17% were uninsured, and 76% were people of color.
And I think that is why we said we would be enthused to do the additional amount if that was a possibility. Just seeing credibility there in their demographics and service delivery.
They also do have quite a large budget, which is why I think we decided not to fund at the full request. But we did feel like it was important to provide some funding.
Yep.
445 FTEs,
Large organization.
$42 million in salaries and wages.
They do have a very large budget.
Yep.
Yeah, and so in the previous award cycle, they received 169,000 from cities, but not Sammamish, did not receive a request from Sammamish. I don't know. This year they're requesting about 269,000 from cities, asking,
And their other
basically-
revenue is pretty nothing.
I'm sorry, what was that?
I'm just looking at their revenue. They
Mm.
don't have county, state, foundations, corporations, private funds, fundraising, in kind. The only revenue that they show is a City of Bothell Human Services funding of 10,000.
I'm guessing the other, some of their patients are covered by Medicaid, Medicare.
Mm.
So it's just a
Okay.
question is where does this $268,000 worth of total match up with their $68 million worth of projected agency? Wow.
Yeah, it's an interesting amount of ask considering the size of their overall budget, of how much they're only asking cities to pay for a small actual fraction of what they're actually providing. So
And we did have that question as
yeah.
well, are yes, I just, we did see credibility in the program, but also that their funding level is so high, but also saw just credibility in what they're doing, that the contribution seemed at least worthy as a consideration for the medical program.
It's kind of hard to compare the expenses of an agency to the expenses of a program in this case.
This is an interesting one. They project 150,000 approximately appointments, and they're asking the cities to fund 835. So just a very small fraction of their total overall budget.
Mm. And they are a nonprofit, right? Because we can't
do.
fund a for-profit.
Mm.
Yeah, they are a nonprofit. So their income must come from all of the insurance and the fee for service.
It's kind of hard to tell from the information we have, but that's what we're assuming.
Yeah.
Since they have, very little in this
Mm-hmm.
information here, and they don't show like federal, state grant money either.
I mean,
That's why we said 0 last time.
it just raises an interesting strategic question for us. Like, do we want to fund, even though it's an exceptional, it seems to be a great program, like, do we want to fund programs that are already well funded, or should we be diverting resources to organizations that may be struggling to get funding? They're doing good work,
Mhm, mhm.
but are struggling to get funding. Like, it's a strategic decision. You could say, you can just go by, whether a program is, a well-intentioned program or is providing useful services, and you fund all of them. But in this case, like, they clearly are very well funded, and I don't know what our $10,000 will do for them.
Mhm.
So it's
You
a
know,
broader.
I think we have to be careful with that reasoning, because if we use that reasoning, then we have to go back and look at organizations like Friends of Youth, because they get a lot of funding out there.
Not to this
And-
level, though.
Yeah, this
This
seems
is,
very
I mean,
high.
they're more like probably a $5 million. This is a
Ah,
what?
69 million.
69 million,
Oh, no, their total
I'm-
estimated agency budget is about $150 million.
150 million.
okay.
Yeah.
They're a large
that's
organization.
Yeah.
You're talking about a completely different stratosphere, like,
I mean, 10,000 is like a drop in the bucket for them. It's
Oh,
like
yeah.
pennies.
Yeah, but that 10,000 could mean a lot for a smaller community-based organization. So that's where, like, thinking
very valid.
strategically comes in.
They aren't specifically focused on communities of color is another thing, right? I mean, it looks like a large, do they have a percentage?
Yeah, there
Pretty
was a
high
large
percentage.
percentage of people of color served.
Also, their area of coverage is really wide as well.
Yeah.
Yeah, 76% were people of color.
Okay. And they suspect to serve,
Interestingly enough, yeah, they served 97 Sammamish residents in the past cycle. They expect to serve about the same. And they're, requesting the city to fund some of those.
right. Yeah, it is I agree with Nishina. It is a strategic question that we should
Yep.
maybe have
Yeah.
a conversation
Yeah.
about
Yeah.
as a big question.
Yeah, we could put this on the,
Be-
cut list.
Yep. And we struggled with that somewhat
Mhm.
as well. And so you've extended our comments.
So let me ask you how you guys feel about this. If you have a organization out there whose salaries are at almost $1,300,000, but they're only spending $22,000 for client assistance, is that good or bad?
If they have $1 million budget and only 22 go through, I
No,
don't
their
understand.
salaries are $1,300,000. And client assistance is,
Well, it depends if they have other programs. If they're like, say, a rental assistance and they have another, 500,000 going out to rental assistance.
this isn't rental assistance.
You're talking health.
So
codes.
what,
Just the first one with Friends of Youth. The
mean-
ratio always bothers me when I look at these things. When I look at, multi-million-dollar or $1 million salaries going out, and I'm giving $10,000 out to help a person,
Mm.
Well, I guess it depends what
it's
they're,
like-
it depends what they're spending it on. Because if they're, for these organizations, salaries is going to be their main, for most of these organizations, they don't have other assets. What they have is their people. So their
I agree.
biggest expense is going to be salaries. And then the second biggest is likely rent. Like if they have a building.
I agree.
So all of these organizations are going to have a high percentage of their budget's going to be salaries. That's
Not-
what they do, is they have people helping people.
I agree on most of that. but
Right.
When if I look at a ratio at some of these.
Are you
some of them
thinking
are
at
not even-
admin costs versus program costs? Is that what you're getting at?
Which one are you looking at in specific?
You want to,
Take the first one.
which in Friends
The
of
Friends of Youth? Okay.
Okay. Let me look at that one. Friends of.
Maybe it's an
Youth and then-
interpretation problem on my part.
Friends of Youth.
Projected salary and wages.
Program or for the whole
That's the
organization?
thing. I mean, that the confusing part can be stand that like they're
That's for
sharing
the
their
people
salaries for the
working
overall organization, but the funding they're requesting is for a specific program. And they may have multiple programs, right?
I think you're right, Yushina, that the way they fill out these applications, some of them are providing information that looks to be the
Yeah.
whole organization, and some of them are just
Yeah.
program specific.
Okay.
So it's hard to tell if it's related to just this program or to something else. And then, like on the Friends of Youth, they say they have $1.2 million of salary, but they've got 31 FTEs.
That's for this program.
Well, this is for
We
the whole
don't know. That
agency.
could be for the whole organization.
I
but
thought the right
don't-
column was supposed to be the whole agency.
No, because I've got another one for Friends of Youth and their wages are only 200,000. So
Yeah, I think it's for that specific program, but
Program.
but each organization appears to have, I mean, you probably saw it in your others as well. They fill out these things differently.
Yeah,
It's
but it
confusing.
depends like what our guidance tells them. Like if we say that we need the budget for the program, then they might fill it out for the program. I mean, we maybe in the next grant cycle, we could look at our application to see like what is the guidance that's included so that there isn't this discrepancy,
Mhm.
Agree.
because this one, like I said, this one is on this program. They've got different budgets for the other programs that they're seeking funding for.
So this program, okay, so for this program, what is it for? This one is for the
The
shelter. And they have 30-something FTEs, right?
31.
31.
31. Yeah. And then on their other program, they've listed, 400,000 in salaries and 7.2 FTEs.
That doesn't make sense. Does it make sense? Wait, so their salaries are lower, but they have twice as many FTEs?
Yeah, that seems like a lot per FTE.
Yeah, this is confusing.
Well, it's probably if that's on,
Do we know, Rita, are each of these budgets specifically for that particular program?
Yeah, it appears so for Friends of Youth that, yeah, they all seem to have their own budget within each of the programs.
So where's my calculator on here? What's
I'm just eating up
1.2 million
time, I'm
divided by
sorry.
31?
so in the second program that I'm looking at,
It'd be about
Um,
50,000, right?
yeah, the 400,000 divided by 7, I mean, it's,
It's
a
really
living
low.
wage.
Yeah, like the 1.2 by 31 is going to be about 50,000.
Yeah.
Or wait, 40,000.
And same thing with the other program too, right?
That's not very much in terms of salary per
Yeah.
person.
It's less than 60,000 a person.
Yeah.
So they're not paying that much.
Yeah. Yeah.
Yeah, for their staff.
Now compare it to dentist.
I don't know. Stan, I want to address
I
what your
just don't know
concern
if it's
is.
something we should take into consideration when we're looking at
How much they pay in salaries? I mean, if we were to take that into
comparison to how much they
consideration.
use for assistance of people.
No, but the people are the people who are doing the work.
That is the
So,
product.
I realize that, but if I'm giving you $10,000, or let's say I give you $100,000, I'm not, but
yeah,
let's say I do.
okay.
And you help one person with that $100,000 and the cost of helping that person is $5,000.
So that's a
Is that a
different,
good
that's
ratio?
that's a different analysis though, because this isn't,
So Stan, what's happening is that like the salary maybe like the total cost that they're sharing, like the expenditure on salary could be for the organization, but then the organization, and especially Friends of Youth being a larger organization, probably has multiple programs, right? So you are seeing like, so suppose they're asking for 10,000 for one particular program, but that program may be one of a dozen programs they have.
And I realize
So-
that. They
so-
do.
But their salaries, like the staff are actually working across those dozen programs that they have, not just the program for which they are requesting funding.
When they submit their grant request, this salary that they have listed in this grant request is for this grant. There's another grant request, several of them, that have different salaries because that's what those people are dedicated to. I got a neighbor that works at Hope Link, and they do the same thing. They break it down per grant, who's going to work on that grant. So I just didn't know if it's something we should take in consideration.
I think in
Yeah.
general, you do want to look at how much we're giving and how many clients in Sammamish they're serving. So for $10,000, they're serving however many clients. 60.
Mhm.
That's a pretty good ratio. That's like $6 per person, or $600 per person. No, what is it? 60? What did I say it was?
No, they're
10,000
helping
divided
four.
by 60.
They're helping 4 people.
Oh, I'm sorry, 60 nights, 60 bed nights.
Yeah, in a
So,
building that they
and it could
got.
be 4 people or it could be more than that. But when you're looking at salaries, that's a different metric. Like, it's not really, when you're looking at a program, I just will say from a nonprofit again, like the biggest expense on any nonprofits, most nonprofits balance sheet, unless they own buildings because they like are providing housing or something, is going to be the people. And so you actually want the money to go there. Like that's showing that that's a big program expense.
I agree.
So the
I
salaries
work
is,
with a multi-million-dollar nonprofit.
so the salaries is not, I wonder, I guess my question to you would be, are you conflating both like salaries to admin costs? Because I think that's often a challenge that people say is like, I'm giving this money, how much is going to administration, how much is going to program? That's
Correct.
a different question than how much is going to salaries and how much is going to program.
If you look at cost.
Right. So if you're looking at costs.
What percentage of the money that I give is helping a person?
Right. So if you're having a service, a program that's doing case management, right? Case management is, you need a person to meet with them, to give them referrals, to help them figure out how to navigate whatever system. If it's going to salaries, that's 100% is going to help those people. If you're looking at salaries, if that's what you're funding. So it's not I think the concern would more be how much is going to admin costs, like, I don't know, accounting and copying costs and stuff like that, as
Yeah,
opposed
there's
to
administrative costs involved with everything.
services. Because salaries, most of that is going directly to programs.
Well, I think we're halfway through, but we're more than halfway in our 2-hour meeting.
So
now.
sorry. Okay, I'll stop now.
It's a worthy question.
wanna move
Staff,
to Matt?
Rita.
On to the next one.
Okay.
Yeah. And,
That's
and-
okay.
and
No,
very-
it's all good discussion.
Dilute
No, it's
Rita,
things.
did
I
you have?
apologize.
And very quickly, just to a book note, so the City of Kirkland specifically told all providers that they expected to be paying extra allocation of funding for staff wages. So they expressly asked providers. So I feel like a lot of the providers may be kind of showing that because one particular city that funds quite a lot. So requested that specifically of all providers.
Okay, so our next one is MAPS for their food and gas distribution program. This was an interesting one. They received 5,000 in the previous year. They're requesting 10,000 in this year. This program provides food and gas cards to those in need, redeemable for food or gas, just, a card they can use. They're listed in the 211 Directory of Services. They get referrals from other cities and nonprofits. Their measure is not to turn anyone away, and so far they have not. They cited examples of giving gas cards to people to get to job interviews that resulted in the individual getting a job. So we recommended keeping the amount at 5,000 this year because Rita showed us their service numbers, and they struggled to meet their service unit goals. They cited increasing additional needs, and paying living wage to their staff as the increase. But we decided because they did not meet their previous goals, or they had trouble reporting, that we would keep their funding at the same amount. Mark, did you have anything to add?
I don't think so. Again, access to all, and I know I'm repeating, but
And this is one where we don't distribute unless they can prove their delivery.
right. Quarterly basis.
Okay. The next one, I believe it's you, Mark.
It is, yes. Essentials First World Food Program. This is a new application. We had some discussion about this, significant discussion about it, and kind of their explanation of the need for culturally specific food for residents facing food insecurity, just varieties of reasons that people have a need for ethnic varieties of food. So providing gift cards to local ethnic food stores and aimed at low income residents and new refugees. Open to discussion. The request for this year is 8,000. Seeing credibility in the need, but as a new opportunity, we were recommending at the $2,000 level. So
May I?
Yeah.
Rita, tell me if I'm wrong, but my understanding, Issaquah Food Bank does culturally sensitive food. Is that correct? They've been,
I believe all food banks are trying to sort of go towards that way. I just don't think that they're able to really hit and really serve all different cultures. I know they're aware of it and they're trying to, and I don't know like how well. I know that again. Hope Link and Issaquah Food and Clothing Bank have that. They obviously want to serve everyone. I don't know how well they're able to do that though.
I wish Tom was here.
This is also, the program is a little different in that it's the form of food cards. Part of it's in the form of food cards
Right,
to
we had
ethnic
questions about
food
that as well.
stores versus, distribution of food at food banks. So again, it's kind of a novel program, and we wanted to see that they could actually deliver and deliver to Sammamish residents. So we didn't fund them the full amount.
Right.
Did they say how they make distribution of the cards?
They did.
I'll flip through it. but- I don't see how they find the clients.
I think they get referrals. Hold on, let me. It
And also,
seems like
there's also P banks on their other program of the hygiene and household items. So I think that's and it's a good point, like how Commissioner May, you were saying the distribution points. So my sense is that along with their hygiene program, they're going to be offering this.
Well, I see that they do a survey and ask people if they need a culturally sensitive food box or something like that.
And they do marketing, yeah, and outreach.
It
Heard of
seems
monthly
like a
referrals
y-
from more partner organizations.
Yeah, their brochures are available at select food banks. They have social media. They're encouraged to visit the Bellevue office to get assistance. And then they conduct distribution events regularly where they meet recipients of the other aid kits as well. But their strongest channel remains word of mouth referrals from the partner organizations.
Do they work with specific, basically stores, or that, can I take this into, any Afghan store or something like that? Is it very specific set of stores that people can go to, or is it, just anyone that they can go to?
I believe it's specific stores, but
That
let me
was
just
my
quickly.
understanding,
Yeah.
or
Okay.
may have been my assumption, but it's specific stores that are.
Yeah, it'd be interesting to
Yeah,
kind of
those.
know what's the diversity of the
Mhm.
stores that they're working with. So is there, how broad is it culturally?
They mention demographics that include Latino, Brazilian, Asian, Afghan, Slavic, Somali, Mideast. I think they're trying to serve a wide swath of both people in the area and immigrants.
It's like a unique program because I doubt that most local ethnic food stores are large enough to, or whether they accept food stamps. So even if people are eligible for food stamps, they would still not be able to go to the local ethnic stores. So from that perspective, so you're forced to go to a mainstream store, even if you are eligible for food stamps, and you can't get the ethnic foods that you are used to. So from that perspective, it seems like a unique program, an interesting program. I mean, I do think for something like this, any unique programs we fund, we should try to capture learnings from those programs whenever we identify anything unique. Like we should at least ask them, how are you trying to capture learnings from this particular program, and could you share those with us? Or when every second year we have a learning year, right? So when we have panel discussions, we should try to invite these types of programs that are trying to do something unique in the community for our own learning, to see like if we are testing new innovative models, what are we learning from them?
I think it's about this point that we had some of the same discussion as well, that we would love to, to learn from some of these agencies, some of the things that they're learning, just so that we can gain in our capacity of understanding and having good judgment and understanding how they measure and all of that sort of thing. So along this point, we kind of were like, this makes a lot of sense. It would be helpful for us to learn how something innovative works and some lessons learned. So.
And you're right, they mentioned specifically that state and federal programs, they provide the cards, EBT cards, but you cannot use them many times at ethnic food stores.
Exactly.
And so that's why we liked the program. It's, new and novel, and it's through
Essentials.
Yeah, Essentials First. So yeah, I think that's a great idea in the learning sessions to
Yeah,
get feedback.
I think they're a great candidate for our little
new
roundtable
panel.
session that we
Yeah.
have
Mhm.
when we bring the panel in. And, an opportunity for a lot of these nonprofits who aren't familiar with some of the others on being able to share ideas. And I think we should find a way to help facilitate that if we can.
Yeah, I mean, to answer some of the questions commissioners had, like who, like Rich was saying, like how do they reach out? How do they do outreach? How do different communities learn about the program? Like all those are interesting things to learn about.
like the rest of you, I'm in a lot of meetings every day, and I can't remember what meeting it was today, but the discussion around capacity building and helping agencies be able to serve better and that sort of thing. Where is funding coming? So there is some of that discussion around that, helping to convene and learn and have more of a connected relationship. So, what you're voicing is voiced other places, I'll say.
So we'll move with, right now it's recommended at 2,000 and we'll move on to the Hope Link one.
Yes, thanks, Chair. So then Hope Link, this is the food program, and this is a program that provides for households that make 400% of the federal poverty level. Qualifying households are visit twice a month. And then there's an emergency bag program. Anyone needing immediate food assistance can request a bag, which consists of 6 meals. And then home delivery is available for homebound individuals. This program was funded at $5,000 in the last biennium. The request, which we found slightly humorous, was $7,399. And so we did recommend, based on credibility of the organization and as they described the food program, to fund at the full $7,399 level.
Okay, the next one we have on the list is Kindering. Their families in transition. This is a program to help young children and their families who are experiencing homelessness. Every child has a developmental diagnosis, and so they provide health for infant mental health resources, language, occupational, and feeding therapy. They have play groups and parental coaching and a family resource coordinator. The ages of the children are ages 0 to 5. Again, they cited, the effects of the pandemic making homelessness worse. They did not get funds from SMASH in the 2021 cycle. They're wanting to increase their programs, increase in staff, and provide wages, raises to living wages. So they requested $6,130, and we recommended $3,000. This one we felt that it was a good program. I can't read it. Was there a delivery?
Yeah, I mean,
issue?
we did not fund in the last go round. And as far as residents go, we know it's a smaller number of residents, but they're the more vulnerable, but yes, so they project to serve for SMARISH residents in 2023.
May I ask where they provide their services at?
I believe in the home and
Yes.
at Kindering as well.
I think it's in the
but
home.
Yeah.
They kind of meet the families where they're at. They launched in 2013 with funding from the Gates Foundation. They provide to children who lack stable housing the opportunity to make developmental gains at the time when they're young, and it's a critical time for brain development.
Do we know if they have their own therapists, or do they work with, or do they outsource a lot of the therapy work?
No, it's all in-house. It's Kindering, so they have a big repertoire of different counsellors and specialists.
Great.
Okay, the next one, Rich. I'm sorry, Rich.
Mark. So the next one is another Friends of Youth program. This is transitional living. This is the only transitional housing program in East King County to serve young adults 18 to 24 experiencing homelessness, case management to help develop an ILP in areas such as employment, education, mental health, and community connections. And again, not using the term wraparound, but or the word wraparound, but seeing this being a fairly comprehensive with young adults that are on site. So as the only transitional housing program. The request
Yep,
is,
a little louder.
I'm so sorry. So the funding level in 2021 was 6,000, and we are recommending for the same funding level as their request this year for 6,000. So continuing, their request was flat from 2021.
So we gave them 6,000 last year. Is that right? I mean, last round, and it looks like they didn't serve anyone. Is that right? Okay. I mean, I think it's fine because it's such a small amount and it's a regional kind of situation, any of these housing programs. So I think it's a good recommendation, but just wanted to clarify that.
Yes.
Ages 18 to 24, and they're young children. I mean, wow.
This is young adults is the term they're using with this program. Okay, further discussion?
And they pay rent, and 25% of the rent is returned to them at their exit.
Correct.
I mean, that's pretty amazing right
Yep.
there.
Okay. Congregations for the Homeless.
Okay, so this is the enhanced shelter. It's a 24/7 shelter for men, approximately 100 men experiencing homelessness. They have facilities like bathroom, showers, laundry, food. They provide case management, addiction services, mental health, and employment support. Their request was for $6,000. Yes.
Mhm.
Yeah. Up from 5,500 in the previous cycle. We recommended 6,000. Again, this is one where, hard to determine the number of Sammamish residents. But in 2021, they provided over 800 guests with 37,000 bed nights, low barriers to entry. The clients they served were approximately 61% BIPOC, high service levels to disabled refugees and immigrants. And they're moving to a new facility in 2023, which means they would be paying rent and utilities. So their costs are going up.
They're remaining in Bellevue.
They are, they're very different location. They have been just across from downtown at the Lincoln Center, and they're going to now be in the Eastgate area. If you get a chance to go by, it's pretty impressive how quickly things are going up. So
David Dowling has done a fantastic job with Congregations for the Homeless over the years.
explaining services matter, it's in outcome stories, I think, matter as well. Okay, next is HopeLink and housing. Again, credibility and outcomes of the organization. This is for 19 units of emergency shelter, 51 units of transitional housing, and 35 units of permanent housing. Clients receive comprehensive case management services and then access to all HopeLink services, including employment, financial literacy, and adult education. Funding level that the city of Sammamish did in 2021 is $5,150. Their request was for $5,304. I'm reading correctly, and we recommended at that level of $5,304. Okay, Attain Housing next.
Home stretch.
Yep.
Okay, so this is Attain Housing for their stable home rental and move-in assistance. Let's see, this is new application for rental and move-in assistance funds. 97% of the families helped in 2021 remain in homes for 3 months after receiving assistance. They get referrals from low-income housing providers, faith-based orgs, and school districts. It was established in 2014. Sammamish has not funded in the past, but 64% of those assisted identified as BIPOC, 28% were immigrant. They partner with other providers like HopeLink, St. Vincent de Paul, They require at least one minor child in the household, and nearly 1/2 of the staff are lived experience. So coming from homeless, and the board is requiring them to pay a living wage of $65,000 a year. And so they had not received funding from SMAMISH in the past. They requested 5,000, and we recommend 5,000. Okay, questions on that one? No? Okay, the next one is Bridge Disability Ministries. This is the medical equipment, the Meyer Medical Equipment Facility in Bellevue. They refurbish medical equipment and mobility equipment. There's no application. Its eligibility is to anybody. You just pay like a donated amount. There's so low barrier to access point for people that are low income or people with disabilities. They did actually assist 53 SMAMISH residents in the last cycle. They requested, I believe it was 25. Oh, no, they got 2,500. Sorry. In the last cycle, they requested 5,000 this cycle. And we said we would recommend 5,000 because they're going to use the funds to cover staff wages and benefits so they can be competitive.
That's good.
Okay. The next one, Lake Washington School District Pantry Packs. This is the program where they provide food packs to children in the Lake Washington School District that don't have adequate nutrition for the weekends, the school holidays, and the summer. It's a volunteer program. They requested 5,000, which is the same as what we had granted them in the past. And we also recommended 5,000 for this cycle as well.
Yeah. What does a food pack consist of?
2 days of food.
I don't know exactly what's in it, but it's, like foods that they, over the weekend, they can eat.
2 days of. yeah.
2 days
yeah.
of food.
Yeah.
Peanut butter. and
Peanut
things like that.
butter. Yeah.
Okay.
That, canned foods, things that for them over the weekend. They do it just, I believe they do it discreetly so that, it's
Children aren't
less
singled out.
embarrassing to children to know that they're getting those. Okay. The next one is MAPS. It's the information referral resources. They provide 24/7 referral and information. So it's basically an information network, particularly those who have cultural or language barriers. They've requested 5,000 and we recommended 5,000. Their request was based on an increased need and then also wanting to, I believe they wanted to hire additional staff and increase their staff. Yeah, adding one additional full-time caseworker to the one that they already have, bring their total to 2.5. So they're uniquely positioned to address cultural and language issues. 70% of their clients are Muslim. And they have their offices in Redmond. Any questions? Okay, Eastside Baby Corner. Okay, this one, their 2023 request, again, very specific amount, $3,600, which is the same as what was granted in the past. I think, we know Eastside, most people know Eastside Baby Corner and the items that they distribute, helping children from young age up to middle school. They're a strong partner with local agencies. They distribute, their items, their personalized items. They get a lot of community donations. I've donated and volunteered there with my kids.
Commissioner Varnes, I have a staff mistake I have to own up to. That actually should be 6,000, not 3,600. That was a previous amount that we allocated, and that is my bad, and I take full responsibility. And I will make sure that that's amended.
Okay.
So they had actually increased their request to 6,000, which you
Yes,
both agreed
I
to.
thought
So
so.
I beg
That
your
was a
pardon.
a recommended.
6,084. That's why I thought it was very
Okay,
specific.
I'm
Yeah.
so sorry. So
Okay.
I own that.
And we recommended it.
Yeah, but we recommended
correct?
funding them at the
Yep.
full amount. So,
Sounds good.
We're going to food now.
Yeah, 6,084, is
84.
that right?
Mhm.
Yeah, yeah. Okay, the Washington Poison Center. They provide 24/7 immediate free medical assistance to people on the telephone, not just within King County, although that's where most of their funding comes from. They also provide educational programs for community awareness. Their request was $3,360, and we recommended funding them at that same amount. They received 2,000 in the last cycle. They provide a service that includes, poisoning of young children, accidental or intentional by, young adults, and then also seniors who may have accidentally taken too much of their medication. So they provide services across the spectrum. They also have access to 260 different languages, and their goal is to keep patients in the home, avoiding a costly emergency visit.
Very graphic and helpful study for how to communicate with all communities.
Yeah.
Languages.
Okay, the King County Bar Association, the neighborhood legal clinics. Their request was 3,000, and we recommend 3,000 as well. They provide low-income residents with free legal consultation in subjects like family law, debt, bankruptcy, immigration. Their housing justice program provides legal representation and assistance for residents facing eviction, and they provide neighborhood legal clinics. They cited a higher need to service more clients and higher costs to deliver services. They provide pro bono services to low individuals on the Eastside. They say that there's increased need due to changes in unemployment benefits and other pandemic side effects. And in the last cycle, they hit their service, they kind of hit well beyond their service delivery numbers. I believe they served over 70 residents of Sammamish. So we felt that their ask of 3,000 was fair.
Yep.
Okay, next one. Congregations for the Homeless, their rotating shelter. This is a year-round shelter open in the evenings for 30 men experiencing homelessness. They have teams that help men to set goals, access housing resources, and working towards self-sufficiency. They provide access to medical, substance abuse, and mental health support. They're requesting $2,500, up just slightly from $2,250 in the previous ask. They provide services at rotating community of churches. And their metric was 60% of men have achieved stable housing over the last 10 years. It's one of the best, they say it's one of the best success rates in the county, sorry.
Do their mental health professionals, are they part of the organization, or do they outsource, or do they do like volunteer work,
They do have on staff addiction specialists and behavioral health, mental health specialists. Yeah.
This is the one that they are at Mary Queen of Peace?
So they rotate between lots of places of worship. This isn't 10C4. This is just like it will go to different
Okay,
places of
got it.
worship. Yeah.
It's the
Thanks.
rotating.
Okay, the next one is the Assistance League, their Operation School Bell. This is support to students and low-income families in Lake Washington School District. It provides them funds to purchase food, clothing, school supplies. They give them gift cards to shop, and which is a change from where they used to give them vouchers where they had to go to Fred Meyer. Their request was 2,000. 2,000 is what we gave in the last round. And we are recommending the same. It's all volunteer run program. The funds go in and they go out in the form of $150 gift cards, which they raised because of cost of living and inflation.
how many people in Sammamish did they serve?
72
70.
and project 70.
That's good.
Okay, the last one is Congregations for the Homeless, their housing program. This is 70 housing units that are around the area of permanent housing for stable living. In this program, the men actually contribute 30% of their income to paying the rent. So it helps get them back towards stability and paying for their own support. They say their residents are 30% BIPOC, 55% have disabilities. A large portion of them struggle with mental health issues and addiction issues. Their request was 2,000, and we also recommended 2,000. It's up from $1,500 in the previous grant cycle.
Correct.
Did you say this is permanent housing or transitional?
They have housing units.
Okay,
They are transitioning the men to stable,
okay,
Living.
got it.
but yeah, these are actually housing units that they have.
Good job, you guys.
That's
That's
it.
a lot. Thank you for reading all those.
Yeah.
And wait till you see all of the 5 numbers added together.
Thank you for covering me.
Happy to help. Sam.
Julie,
Yeah.
Julie went above
Yeah.
and beyond.
For those of you who don't know, my father-in-law passed away on the 3rd.
Oh, sorry.
Oh, I'm sorry.
It was like 10 days from the time they found the cancer to the time that he passed away.
Oh, my gosh.
It was really quick and kind of a shock. So everybody's adjusting. But thanks for covering for me. I appreciate that.
Great job on this. Thank you.
Okay. I assume Mike has the 5 all added together and where the numbers ought to be versus where the numbers are. And
Yes, that is an exercise that Rita went through ahead of the meeting. So we do have a spreadsheet showing the compilation of all of the subgroups' hard work. I thought we would just start with a few quick slides, just sort of outlining the process to date and our next steps. So let me share my screen here, and then also share it on Zoom. Let's see here. Give me one moment. Okay. Okay, so process to date, this isn't going to be unfamiliar to any of us, but as a first step, the commissioners reviewed the grant score sheet and ensured there was alignment with the needs assessment. So making sure how we were scoring the grants aligned with what we wanted. And the commission here proposed some changes related to adding some categories relating to COVID-19 and some other tweaks. And then we assigned commissioners to their preferred subgroups to break down the large number of applications that we had to review into a more manageable number, although still not small by any means. Commissioners independently reviewed the grants with the score sheet that was approved earlier this year. And then subgroups met to review the independent work and debate and refine into a group recommendation to the full commission. Like tonight, all subgroups presented their recommendations. And as a next step, we need to look at reconciling the refined grant recommendations with the assumed budgeted funding. So we'll get into this a little bit more, but the expected budget, which is essentially what we have budgeted in 21-22, is 440,345 per year. And the current recommendation when tallying up all the commission's recommendations is 661,859. And so looking at next steps, we'll need to refine the preliminary recommendations, 661, to get closer to the assumed budget, decide and implement a method for achieving the 445. So do we want to peanut butter spread a percentage across all the groups, or do we want to be a bit more surgical in how that number is achieved? And then look at considering an additional funding request to the city council. So this is what the commission has done in the past 2 or 3 grant cycles, where we say, okay, we've met the budget that we had last year, but we'd like to consider some additional funding this year because we have a lot of great programs out there in the community that deserve some funding. And historically that has been successful, and we've slowly increased the funding that goes to the Human Services Grant Program. And then the commission will, after debating and deliberating, approve a recommendation package that will go to the city council. And the commission will approve the recommendation in September and present the recommendation to city council in October. And historically, it's been the chair and the vice chair that have gone to the city council to kind of lead the presentation with other commissioners in support, but that's something we can talk about if we want to do a different way this time around. So that's kind of a high level look at the process. Let's pull up the spreadsheet now, and probably not tonight unless the commission has interest in staying late. That's something else we wanted to bring the commission's attention, is that currently on our calendar, this is our regular July meeting. August, historically, commissions and the city council takes a recess, so there aren't typically any meetings. So this is our meeting for July. Our next meeting is in September, when we're actually approving the recommendation package. We feel that there probably needs to be another meeting between now and then to have a little bit of discussion on getting to that recommendation prior to September. So that was one of the things we wanted to bring up was, is there a will and availability to hold another meeting potentially later this month? Do we want to discuss that now before we look at the spreadsheet?
So that will be the second Wednesday. I believe it's September the 14th. Is
Correct.
that right, Mike?
September the 14th.
Yeah.
Start with the spreadsheet. Okay, let's put a pin in the special commission meeting that we're thinking about adding, and we'll look at the spreadsheet now. So for those of you who are returning commissioners, this will look very familiar to you. What we have here is, well, let's look at the summary here first. We'll zoom in a little bit. So for each priority area, we have the 5 priority areas. We have the requested amount from all the applicants in that area, the subgroups recommendations, and for subgroups that presented one, the extra ask, and then the percent of the total recommendation in each area. So 44% of our recommendation is currently in the basic needs, 26% in mental wellness, et cetera, et cetera. And then below, we have the full breakdown as we've looked at before. And then at the top here, we have a little bit of a counter that shows the amount that's over or the amount that we're under the 440,345 assumed budget, and then an additional row here for the additional recommendation. So how we've done it in the past is that this is kind of dynamically updating. So there was a bit of horse trading at, typically there's a bit of horse trading at the commission meetings where, the commission's discussing what do we want to shift around. And as we change these numbers, this number here changes, and we can kind of see how we're getting closer to the assumed budget. So that would be the thought for the special meeting potentially later this month, is that we could have that discussion. In advance of that, our thought was that the commissioners could go back with their subgroups and talk about, because I don't think, it doesn't seem like the 661,000 that the commission is proposing here, I think you all likely feel is kind of the base recommendation. Like after reviewing all the applications, this is really what we want. This is the number that we want to recommend. And so I think, we need to hit the 440,345 budget number. But I think what the commission could consider doing is shifting the amount over 440, 345 into the extra ask column. And so when we go to the council, it's here's the base recommendation plus the extra ask, but really the full 661 is our true recommendation. That's kind of how the commission's approached it in the past. Does that make sense? Am I explaining that? I feel like I'm rambling a little bit. If there are any questions, please stop me and read it.
And just to sort of give a little bit of context, it turns out like it would be 30% that we have to shift from the recommended column into the extra ask column. So, as Mike says, like, as commissioners, you can decide to be like, everyone just gets shifted, or you may say, no, there are certain applications that we want to fully fund or whatever else. So that's really up to you as a commission to decide. But it's really 30% that we need to move from the recommended to the extra ask column. So it's shifting.
If we could add a column that shows the difference between the percentage of the recommended of the request. So we can see for each group how much over or under the request. What do I want to say? I'm trying to figure out, like, for us, this is very self-centered, I know, but like for our group who did cultural inclusion, seniors, and domestic violence, where we like, for example, under seniors, we were about 50%. We recommended 50% funding. But for another group, it might be they're recommending 75 or 80% of funding, of which I'd say they should probably cut more than us.
Yeah, that's true. We didn't have extra asks also.
Yeah, which we would we have to put ours into extra
Yeah.
ask, but so that's
Okay,
one way of thinking
so-
about it.
Mike just did that. This is how the brainiac he
Okay.
is. He's shown a breakdown.
There you go.
For example, the basic needs group recommended 67% of what was requested,
Right.
mental wellness 70%, et cetera. This doesn't factor into extra ask yet, but extra ask.
And
is
then
a
I would
huge,
put the dollar amount difference there too, because even though I'm advocating for us, the domestic violence VR is 73%, but it's really only like $5,000. You know what I mean? Like, then it's like, okay, let's do the five. Well, it's okay. It's $14,000. But
Okay, we'll give you
just
the
wanted to get that
5,000.
information so we can do that analysis. if that's
So
okay. Thank
just
you.
tooting staff's prowess Excel, that's shown right there. Mike's done that.
Thank you so much, Mike. You're quick.
simple
Impressive.
calculations.
And now do we talk about how important mental wellness is as compared to whatever?
Yes, there's also that analysis. Mental wellness is what, the second one.
131,000 of our mental wellness is for what CrossPath and Youth Eastside Service does.
Mhm.
So Mike, the last column is how much we cut from the request.
No, it's the difference between yes, how much you cut. Yeah, correct.
So we're in second place.
I mean, it's not the only factor. It's just like one factor to consider.
But we are given a big percentage still. So we need to evaluate it. I'm sure we can cut corners. We've done it before. So
Yeah.
I would prefer to go back through because there were ones that we identified that we
Mhm.
would reduce or we would cut.
Yeah.
Because I feel like if you cut 30% off of the 2000s, you're just, taking
Yeah.
just a little bit away.
Yeah, I guess.
Yeah.
There's a couple of questions, but I think maybe for our group to be back together, one, because Stan wasn't with us. So I feel like that would provide us some additional, and then maybe I would suggest for our group, maybe just looking at, anything above $10,000, then we would look at a percentage reduction for those or something like that.
Yeah.
I think
that
it'd be
makes
nice
sense.
if our groups have time to reconvene and reconfigure.
Mhm.
And come up with the extra ask. So we don't have to do that in the bigger group. That would take too much time. So if we can all reconvene and then we can present that at the
so
next.
can we get together in the next week?
Yeah. I'll
Well,
be
when
out of
are we
town,
meeting
but I could
again?
meet
So,
virtually.
so Chair, we need to decide like when we can, when the commission would like that second meeting. if they'd like it in July, the end of July.
The 27th.
That's what we were thinking, but that's dependent on the commission.
I will be in
27th.
Washington DC, so I'll be on a small screen.
Well, and I want to make sure that our teams have time to get back together before then.
That will give you 2 weeks.
I would prefer before, one
Make
day
it-
before the 27th. I don't want to get into why, but can we do it like the 26th or the 25th? I can't do the
I-
26th, actually.
I can't do it the 26th at all.
Yeah, I
But the
will also
25th.
prefer like, yeah, not the 27th. I mean, yeah, 26th would be okay for me.
25th, maybe?
25th, 26th would be okay.
Let me see. Can you said you can't do the.
I can't do the
26th.
26th.
Okay, how about the 25th?
I can do the 25th.
I can do the 25th.
Wait, let me just, actually, I need to check something. Sorry. My husband's going to be out of town. And I'm just a little concerned about,
You know, if I'm not here, life will go on.
let me see, 26. Sorry.
26th will work for me, or what about 28th?
28th. So when is he leaving town? I forget which. I think the 28th will be okay for me.
I could do the 25th or the 27th.
25 or
Um,
27 is fine for me.
28th works for me as well.
28th, yeah.
On the 28th, I wouldn't be available till 4 PM Eastern time.
Actually, the
o'clock.
25th isn't great. How about the
Okay.
28th? Oh, I actually,
So
Is
you
she-
can do the evening, right? On 28th?
On the 28th, yeah. It
Okay.
would have to be, what's it now? Because if I wouldn't be available until
7 o'clock.
probably 4:30 at the earliest Eastern time. So that would be 7:30.
Okay.
Staff recommendations?
So we could do the 28th and have Vice Chair Vines start the meeting, and then have Chair Bottenberg and Commissioner Banak present their findings towards the end of the meeting, perhaps be the last group that presents.
If
Does
we're
that
missing all
sound-
the discussion.
Well, as long as somebody from the subgroup is there, they should be able to present.
So the 25th doesn't work for people? Or the 27th?
sorry, I'm not, the 25th is Monday.
That works.
Yeah, the 25th works for me.
Yeah, that's okay.
Well,
25th works for me.
we would be glad to have you with us. so.
On presentation. You only need one
Can we do the 25th? Can we do the 25th?
That works for staff. However, I am out from next Wednesday through Sunday. So if you would like me to be around for any of your meetings, I can do before Wednesday.
Before the 20th.
Yes, that's correct. Yeah.
Okay. I think that's fine. We can figure it out. 25th is actually really good for me.
Okay, so as a commission, we're meeting on the 25th.
Sounds good to me. Everybody all right?
At
with
what
that?
time? At 6:30?
6:30 on the 25th,
6 or 6:30?
6:30. I have board meetings all day for the National Red Cross, so.
Send me email.
Okay, so.
We'll send out a reminder email along with this spreadsheet tomorrow to everyone.
And there's virtual option, right? Okay.
Yes. Yeah.
Okay. So it will be July 25th at 6:30 Pacific time. And do we need to ship our numbers back to Mike by Friday, the 22nd?
That would be helpful. Yeah. So then I could plug it into the spreadsheet and have that ready to go for Monday, if that's possible.
So next week. We need to meet next week. So we all need to meet in our small groups next week, right? Before Friday. And if we want Rita to be there, we have to meet before Wednesday. So just Monday and Tuesday.
Monday or
is
Tuesday.
Basically available. Okay. All right. Well, do you guys want Monday or do you want Tuesday?
I think maybe next Monday, Tuesday.
I can't do a Tuesday. Oh, you mean you,
You and I.
our
yeah.
individuals? Yeah,
Yeah.
sure. Okay. So let's say that we get our act together in our groups and give our best numbers. And that's not cutting it by percentages or anything. It's trying to work the numbers from this column to that column, correct?
It sounds like the commission was trending towards being a little bit more strategic and how things get moved over. But yeah, it's really up to the subgroups if you want to provide just a kind of a peanut butter 30% reduction across the board versus, kind of moving one into one category and one into another.
I
But
said
we're
we don't,
talking about that the numbers that we take from our recommended column that we feel should still be funded can move into the additional column that
right.
may actually end up being that 661 number. Right. Okay.
What's the overall difference? I can't see it.
It's like 200
100
something
and-
thousand.
21,000.
221.
Percentage wise.
I kind of don't want to have a strict 30%,
Me
but I
either.
think maybe we can all aim for that. And if we can feel generous when we're doing it, maybe we'll go a little more, if not a little less. And then when we come back as a group, we can kind of negotiate.
Because you want all your money.
We'll try our best. to go 30.
Well, just
Give
remember,
us.
mental wellness fits through everybody.
When we started, we
You're
said
sounding tougher than I feel
Between-
comfortable.
years
defending.
ago, you can't help everybody. So we got to do the best that we can with what we have.
Do we need to extend the meeting since we're now 2 hours past the beginning of our meeting? Remember, are past our 8:30 time, but we really started at 20 minutes of.
We started late.
I know, so that's we're now 2 hours, right? Okay, who wants to make the motion to extend the meeting by 5 minutes or so?
I will make that motion to extend the meeting 5 minutes.
Is there a second?
A second.
Any discussion? All those in favor? Aye.
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 The only discussion I would have is staff make your report quickly.
Yeah, Rita? You're next.
I am going to save that for our next meeting because, yeah.
Thank you.
And I don't have any commission report myself, so. Is there any business before the order? Anything good for the order? Okay, is there?
Motion to adjourn.
All right. Is there a second?
Second.
Okay, let's call it quits.
Awesome.